This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Perhaps you remember last week when Dina Cook joined us to share her story of lung cancer survival. She told us she had developed a persistent cough back in 2011, and in 2012 she was diagnosed with the disease. Later down the road, Dina developed lung cancer again. She says many times the first question people ask after learning someone has lung cancer is, "Are you a smoker?" And Dina told us she's offended by that.
That's part of the stigma that I think is impeding research and also well-being for the patient. You don't need disgrace along with a diagnosis of lung cancer.
Dina went on to tell us that 20% of new lung cancer cases occur in patients who have never smoked. She also told us since she's been diagnosed, it's made her realize how precious life is.
Well, that certainly comes as no surprise, as lung cancer, according to the Lung Cancer Foundation of America, is the leading cause of cancer deaths in the U.S. It accounts for 29% of all cancer deaths. Lung cancer claims more lives than breast, prostate, colon, liver, kidney, and melanoma cancers combined.
Wow. More than 221,000 new cases will be detected this year, making up about 13% of all cancer diagnoses. Lung cancer is one of the most difficult cancers to treat. It's also often difficult to detect in the early stages, and it can take years to develop. But could new technology be the key to a cure for lung cancer patients?
Maybe so, and what's even more exciting is that it's right here on Delmarva. Joining us today to tell us about it is Dr. Amita Singh, who specializes in pulmonary medicine at Peninsula Regional Medical Center. Thank you for joining us this afternoon.
Thank you for having me.
So what we're talking about today is a new screening procedure, but it's only for certain patients.
Well, not really. Any patient who has a spot in his lung in the form of a lung nodule or a mass is eligible to get this procedure, which is a new Super D technology. And once we actually, do this technology and make a diagnosis of cancer, we can give them an early diagnosis of lung cancer, which will help them to get early treatment in order to increase their cancer survival.
So there's a process that a patient will go through to get to the point of actually using this new technology?
Yes. First of all, if a patient starts to have any symptoms which might be related to lung cancer, like cough or shortness of breath or weight loss, they usually undergo some kind of imaging like a chest X-ray or a CT scan.
Okay.
And we find a spot in his lungs, then we try to go after that, try to do a biopsy of that to find out what is it related to. But most of the time when the patients develop these symptoms, it's already late, the cancer is already spread.
Okay.
So the whole idea is to try to detect the cancer early on. Now, the United States has come up with a lung cancer screening program where any patient who has an extensive smoking history, somewhere around 30 years of smoking history, a pack a day of cigarette, and if you fall between 55 to 80 years of age, you can get a low-dose CT scan where you get low-dose radiation CT, and we can find out if there is a spot in your lung. And if we find a spot, then we can go after it.
So tell us about this biopsy. How does it work?
Well, this is a Super D, which is the electromagnetic navigation bronchoscopy, where we are able to reach far out into the lungs to a nodule or a mass which occurs in the peripheries of the lung. So basically what we're trying to do is create a three-dimensional map of the patient's airways, and which is like a GPS for us to navigate to that certain part far out into the lungs, reach out there and take some biopsies to make an early diagnosis.
A lot of people say they're afraid that when you take a biopsy, you're disturbing it enough that maybe you're spreading cells to the rest of your body. Is that the case here?
Not really, because when we're trying to reach that nodule, we have a small catheter through which we are passing the biopsy forceps. Once we've taken the biopsy forceps are retracted back into the catheter, and then it's withdrawn. So there is no spread of any cancer cells.
So are there any risks involved with this biopsy?
Yes, there is a risk of bleeding, but for the most part, we are able to contain the bleeding during the bronchoscopy procedure itself. There is also a minimal risk of lung collapse, which can occur, but that is way less as compared to the other ways of diagnosing the lung cancer.
And PRMC is doing clinical trials now.
Yes.
Tell us about those.
Well, clinical trials are a very good opportunity for a patient to get, exposed to the advancement in the technology to diagnose lung cancer, as well as get the treatment options. Peninsula Regional Medical Center is a part of Johns Hopkins clinical research trial programs and other NHI, clinical trial programs, where we can actually enroll the patient if they wish to participate. Currently, there are 9 open clinical trials for lung cancers to which we are a part of, and if you find the patient has lung cancer and if they're eligible, then we can get them enrolled into it if they want to.
Offering a lot of people a lot of hope. Dr.
Yes.
Singh, thank you
so much.
And to learn more from PRMC about this new technology, go to WBOC.com. Click on our picture at the top of the page.
You know, loved ones often encourage us to get screened and to take care of ourselves, so we're going to hear the story of one woman who says her dog was looking out for her, why her canine's crazy behavior quite possibly saved her life.
And our pets can sense changes in us, and we do the same for them. This dog's owner noticed she was having trouble eating. How doggy doctors were finally able to find the problem lodged in her throat.
But first, it's time to vote for Delmarva's Neediest Roof. From now through November 27th, we want you to vote for 3 finalists for the 4th annual Delmarva's Neediest Roof giveaway, sponsored by Spicer Brothers Construction. The winner announced December 3rd.
To see the nominees and to vote, go to our website, WBOC.com. Click on our picture at the top of the page. Delmarva Life, we'll be right back.